The endemic nature of childhood diarrhea in certain parts of Nigeria, especially the northwestern states, continues to pose a threat to the national health indices. With a national prevalence of 13% in Nigeria, data shows that diarrheal disease results in 10% of deaths in children under the age of 5. This endemic nature of the diarrheal disease is higher in Kano, Katsina, Sokoto and Zamfara states, which have a prevalence of 20.7%, 18.6%, 18.5% and 21.7% respectively. This burden of diarrheal disease necessitated the ongoing partnership between the Nutrition International and the Wellbeing Foundation Africa to implement the Scaling Up Zinc and Lo-ORS to Improve Childhood Diarrhea Treatment in Northern Nigeria project, supported by the Government of Canada, with a specific focus on supporting the state's drug revolving fund mechanism. This program is part of NI's 3 to 4 year strategy, which seeks to achieve the following outcomes. 1. Strengthen the drug revolving fund scheme of Kano and Sokoto states, which will ensure continuous availability of zinc and Lo-ORS at all primary healthcare facilities in both states. 2. To achieve additional zinc and Lo-ORS coverage of 1,843,832 cases across the 2 states by 2023. 3. To increase the number of caregivers who seek care promptly for childhood diarrhea cases by an additional 2,238,439 caregivers. During this phase of the project, which began in August 2021, the Nutritional International and Wellbeing Foundation Africa state teams in Kano and Sokoto states were able to train 2,594 health workers on best practices of integrated management of childhood illnesses. 2. Provide frontline supportive supervision in 80 healthcare facilities within both states. 3. Provide in-facility and follow-up home visits to over 72,688 caregivers in both states who had reported to the healthcare facility with cases of diarrheal disease. 4. Home visits follow-up to 5,663 children under the age of 5 who presented with cases of diarrhea, amongst which 5,641 were treated and 5,638 had successfully recovered. 5. Successfully inaugurated 810 DRF committee members in Sokoto State, which had a good representation of members from the state and local government.
We are treating children with diarrhea not with Zinc ORS. We are treating with flagyl syrup and cotromazole. But now we educate, and now we are educating the mothers to treat the children who is suffering from diarrhea with Zinc and Lo-ORS.
We counsel the patient based on proper personal hygiene, proper personal hygiene. We give them proper hand washing and proper breastfeeding. That's what we are giving them advice. We give zinc 10 milligram to children with 3 months to 6 months. We give 10 milligram, and we give 20 milligram of zinc and ORS 6 months to 5 years of age.
At Nutrition International, we believe scaling up zinc and low osmolarity oral rehydration solution (Lo-ORS) to improve childhood diarrhea treatment contributes to enhancing child survival. Diarrhea is a leading cause of malnutrition and death in children under the age of 5. Malnutrition is also known to prolong episodes of diarrhea and increase mortality. Diarrhea is preventable and can be treated with zinc and low osmolarity oral rehydration solution. We are pleased to be partnering with the government of Nigeria, the Sokoto and Kano state government on this initiative, focusing on contributing to improved and prompt health-seeking behavior for diarrhea management. In addition, we aim to improve the capacity of health service providers and sustain availability and access to quality zinc and low-ORS commodity in public health facilities in the states. The project has contributed to the training of frontline health workers, donated 155,000 zinc and low-ORS co-packs to Kano and Sokoto states, supported the installation of an inventory control system to interconnect medical stores in Kano State towards improving the drug management system, as well as strengthening drug revolving fund schemes in the two states. I thank the governments of Kano and Sokoto states for working with Nutrition International to contribute to saving the lives of vulnerable children with acute diarrhea. This project is made possible with funding support from the Government of Canada.
Nutrition International and Wellbeing Foundation Africa are very strong partners in the effort to address the issue of diarrhea in children. Wellbeing Foundation Africa and Nutrition International have supported the state in various ways in this effort. Some of the things that have been done include training of healthcare facility workers in the management of diarrhea, where facility personnel have been brought to the state and they have taken some time, some number of days to train these healthcare workers to be able to treat diarrhea in children. Additionally, they've also supported the state in the provision of ORS zinc, a large quantity of doses. In recent times, over 70,000 doses were procured and donated to the state to be distributed to health facilities in the management of diarrhea in children. Additionally, also, I know that they also have supported the state in supportive supervision, going to the various health facilities to see how this diarrhea is being treated by healthcare workers, to identify areas where facilities or facility staff need support to ensure that this diarrhea in children is well taken care of.
In achieving the goals of this project, the Nutrition International and Wellbeing Foundation Africa state teams have engaged in advocacy with state policy makers and stakeholders to get an increase in states' financial commitment to the DRF scheme, reviewed the DRF standard operating procedure for both states, and inaugurated an 810-member DRF committee in Sokoto State. Nutrition International has also carried out the digitalization of Kano State medical stores to ensure proper drug monitoring and inventory management of all drugs in the state for accountability and transparency. This digitalization process, which involves the installation of inventory control, will help the Kano State Ministry of Health to ensure an electronically documented supply of medicines from medical stores. 2. To have an effective and efficient system to monitor the distribution of drugs within the state from the central stores to other medical stores and strengthen the state DRF scheme. 3. Calculating the average consumption over a period of time. 4. Determining the quantity of drug to be requested by each store and health facility. 5. Ensuring the safety of stock and preventing stockout due to unforeseen events. 6. Help to track expiring drugs, damaged or spoiled drugs, drugs soon to expire, and excess stock resulting from wrong request indicator, amongst others.
The Nutrition International have been here with us. One of their representatives was here with us. One of the support is medical consumables, since ORS, they have given ORS to support the state diarrhea program, which are yet to be rolled out because we are working on that. Then also secondly, they also wanted to support us with the inventory control system. We already have an inventory control system, but it's an old one. So the new one that the NI wanted to support us is a much robust one, which we call it Deep Pro. So we have already started some work. Then the NI wanted to support us to continue on that job. So we have informed them about the person who is doing that work. We have submitted the name, and we even made a commitment to write a note to the NI to inform them this is a person because we don't want to go back to drawing board.
In January 2022, the Wellbeing Foundation Africa presented impact data from the Scaling Up Zinc and Lo-ORS to Improve Childhood Diarrhea Treatment in Northern Nigeria project at the Federal Ministry of Health's National Supply Chain Management Program, organized to achieve new approaches to Drug Revolving Fund and Drug Management Agency setup. This project is promoting innovative approaches to strengthening the drug revolving fund within states, and the continuous engagement with critical stakeholders will help ensure a functional strategy for effective supply chain management within the healthcare system.
The scaling up zinc and low osmolarity oral rehydration salts to improve childhood diarrhea treatment in Northern Nigeria project has strengthened the drug revolving fund schemes in Kano and Sokoto states, catalyzing modern medicine with better supply chain and financial procurement management. This project, which was implemented by the Wellbeing Foundation Africa, provided supportive supervision for health workers, in-facility and follow-up home visits to caregivers, and increased community stakeholders engagement, all of which have created a statewide behavioral change that has delivered measurable improvements where it is most needed. I commend the impact made by the Nutrition International and Wellbeing Foundation Africa partnership and look forward to escalating this impact during the next phase of this project.
Population is cast in dispersed population, but now the population is having even issue of sewages. It is also bringing a lot of challenges within the community, which is also youth, the children are mingling with the sewages, the different issues within the environment that has devastating effect in the girl child or boy child when they're taking their meal without washing hand, to also endanger their health, leading to diarrhea and look at the flies, number of insect flies that are flying in the food of the people also is also creating a lot of contamination that will also affect the health and living environment. And people sometimes even having available toilet facilities underwater to the enabling washing hand, frequent washing hand and others is also being affected.
No child should die from diarrheal disease, and Nutrition International and the Wellbeing Foundation Africa intervention in Northern Nigeria will continue to promote the use of zinc and Lo-ORS as the first-line treatment for diarrheal disease. In fulfilling this goal, Nutrition International donated 75,000 co-packs and 40,000 co-packs of zinc and Lo-ORS to Sokoto and Kano states respectively to further boost the availability of this life-saving drug within healthcare facilities in the states.
Ina godiya ga gwamnatin jihar Sokoto da sun ka sawo yan ga kungiya ta shigo cikin nan ta mu jihar Sokoto har wannan rukuni namu dan su ba mu shawarwari mu amfana masu gudawa da amai kuma jama'a su amfana sosai. Allah ya saka musu da alheri.
Nutritional International and the Canada government and the Wellbeing Foundations, they really support us with this training, and we really gain, and our communities are really changed.
The Scaling Up Zinc and Lo-ORS to Improve Childhood Diarrhea Treatment in Northern Nigeria project is implemented by the Wellbeing Foundation Africa with support from Nutritional International and the Government of Canada in partnership with the government of Kano and Sokoto states.